All right, let's dive into a super important topic for your nursing exams, Koch's disease. This is one of those high-yield subjects you absolutely need to know, so let's get right to it. Okay, let's start with a quick quiz. What is another name for Koch's disease? Think about it. This is a total classic exam question, so you've probably seen it before. You got it. It's tuberculosis, or TB for short. So Koch's disease is just another name for TB. It's caused by this bacteria called Mycobacterium tuberculosis, and while it's famous for hitting the lungs, you gotta remember, it can spread to other places too. Okay, so how does this thing spread? This is absolutely critical for your safety and for any infection control questions on your exams. It's all about airborne droplets. So when someone with active TB coughs, sneezes, or even just talks, those tiny little germs are just hanging out in the air. All right, let's put on our detective hats. What are the telltale signs and symptoms? What are the clues you need to look for when you're assessing a patient and you're thinking, could this be TB? Okay, these are your classic big-ticket symptoms for exams. A chronic cough is a big one, but the ones they really love to test you on are hemoptysis, that's coughing up blood, and nocturnal diaphoresis, which is just a fancy way of saying drenching night sweats. Also keep an eye out for a low-grade fever that just won't quit, chest pain, and that significant weight loss, also known as cachexia. So, you've seen the symptoms, you've got your suspicions, now what? Well, we need to confirm it. Let's talk about the key tests you'll use to get a definitive diagnosis. These are pretty much the gold standards for diagnosing TB. First, you've got the sputum test, where you're looking for something called acid-fast bacilli, or AFB. Then there's the chest x-ray to see what's going on in the lungs, and finally the Mantoux test, the skin test. You'll often need a combo of these to really nail down the diagnosis. Now, out of all those tests, this is the one you really have to remember. A positive sputum test for AFB is the absolute confirmation that the patient has an active and contagious infection. This is the big one. This is what tells you, okay, this person can spread it to others. Okay, diagnosis confirmed. Now it's go time. What's our nursing action plan? Let's break down your top priorities and the treatment regimen. So, when it comes to nursing priorities, think about what's going to hurt the patient first. Number one is always going to be airway. So, ineffective airway clearance is a huge one. After that, you've got activity intolerance. These patients are exhausted. Then, of course, the big one, risk for transmission. And finally, knowledge deficit, because this treatment plan is a long haul. Okay, listen up, because this is probably the most important safety point. Before you do anything else, your patient goes into airborne isolation immediately. That means you're wearing an N95 mask and they're in a special negative pressure room. This isn't just a suggestion, it's your absolute number one priority to keep yourself, other patients, and staff safe. All right, let's talk meds. This is a huge topic for exams. The treatment involves a cocktail of 4 main drugs, and there's a super easy way to remember them. Just think of the word IREP. That stands for isoniazid, rifampicin, ethambutol, and pyrazinamide. You are definitely going to be tested on these, so lock IREP into your brain. So here's the problem. The treatment takes a long time, months and months, and getting patients to stick with it is tough. That's why the gold standard of care is something called DOT, or directly observed therapy. It means exactly what it sounds like. A healthcare worker literally watches the patient swallow their pills every single time. It sounds intense, but it's crucial for making sure the bug is completely gone and to stop scary drug-resistant versions of TB from popping. Okay, we've covered a lot, so let's boil it all down to one simple, powerful tip that you can take with you straight into your exam. Here it is. This is what you need to burn into your memory for your exams and for your future practice. If you even suspect TB, what's your first move? Isolate first, always. Once they're isolated, then you treat with IRAP. Just remember that simple flow. Isolate first, then treat with IRAP. Get that down and you'll be protecting everyone and you'll be ready for any question they throw at you.